That's actually quite a big question, only because we still don't know
Yeah.
a lot about exactly what the underlying mechanisms of macular degeneration are. But essentially, as we said, the macula is the part of the retina that does all the central vision. So it's a very central part of the retina. It's where the most in focus image from the front of the eye arrives. And so that's what gives us our reading vision. That's what gives us our ability to recognize faces, to see text on a page, all that really fine detail stuff. Whereas, the area of retina outside the macula is what gives us our peripheral vision. So the macula is the area of the retina that also has the highest metabolic and energy requirements because it's where, all of the density of cells and cell activity is happening. And so as we said when we're talking about retinal detachments, the cells underneath the retina help to provide nourishment to the retina itself. And they do that by taking nutrients and things out of the bloodstream to process and deliver to the retina. And they also take waste products from the retina and send that back to the bloodstream to be processed elsewhere in the body. And our best understanding of macular degeneration is that over time, the membrane in the wall of the eye that allows that exchange to happen. So there's a membrane, that sits between the cells and the bloodstream that allow nutrients to come in and allow waste products to go out. And that membrane seems to get clogged up over time in some people. And the problem with that is it means that nutrients have a harder time getting in to get to the retina, and waste products have a harder time getting out. And so one of the markers that we see that tell us that someone might be developing macular degeneration is something called drusen, which is the buildup of waste products underneath the affected area of retina. And so in that early phase, it's there, and we can see it, and we can say that someone's developing macular degeneration, but their vision is preserved. But over the years following, the retina itself starts to suffer damage because it can't get rid of its waste products and get new nutrients in. And so the cells start to stop, the cells stop working properly and eventually die away. So the kind of intermediate phase of macular degeneration, the cells are sick, they're not doing their job properly, but the structure of the retina hasn't failed yet. But once we get to advanced macular degeneration, what we call geographic atrophy, that's when those cells have died because they just couldn't keep going any longer. And that's when the vision's quite badly affected. So macular degeneration progresses over years. It never causes total blindness. It won't, take away the vision completely, but it does cause you to lose the central high acuity vision.
So it's actually it kind of manifests as a dark spot in the center of your vision,
Yeah,
does it?
yeah. People
Yeah.
often describe like a grey shadow or
Yeah.
a grey blob in the center of their vision that just gets bigger and bigger and more out of
Yeah.
focus. And that's so I should say we always we hear in the media and something about the idea that there's two types of macular degeneration. There's dry macular degeneration and there's wet macular degeneration. What I've just described is what we would consider dry macular degeneration. Now, what I explain to patients is that every person on the planet who has macular degeneration has dry macular degeneration. It just so happens that 10% of those people will get wet macular degeneration as well. So if
Okay.
you have wet macular degeneration, you also have dry. And the thing that makes a difference is that we talked about the retina being damaged by lack of nutrients and that membrane not allowing things across in some patients, we don't have a good understanding of why this happens. There's a bit of a kind of emergency response that the body has to this situation, and new blood vessels start to grow in through that membrane and start to form a network of blood vessels underneath the retina where there shouldn't be any. And you know, the body's trying to do that because it's trying to deliver nutrients to the site, but those blood vessels aren't really helpful to the situation because they don't work properly. They leak fluid, they leak blood. The retina becomes damaged by that. So they cause swelling and potentially bleeding under the retina. And in really severe cases, they can rupture and cause what we call a subretinal hemorrhage, which is where blood pools underneath the retina and that wipes out central vision immediately. And so that's why in the old days, before we had treatment for wet macular degeneration, it was viewed as being the worst type because it could damage your vision very, very quickly. Whereas now, with those injections, we have medications that are so good that we can effectively reverse the wet component and keep it completely
Mm.
at bay. But the reason people aren't cured by that process is that they still have the dry macular degeneration ticking along underneath it. And we don't have a good curative treatment for that yet. There's some new stuff coming on the horizon, which is really exciting. We've got some new treatments that we're hoping become available in the next year or two that should be able to slow down progression of dry macular degeneration, but we don't yet have a treatment that's as good as we do for wet.
Mm. Okay. So the treatment for the wet is that what they call what is it? Anti-VEGF, is that it?
Yeah, so the anti-VEGF medications, that stands for anti-vascular endothelial growth factor. So remember I was saying that, the sick retina puts out an alarm signal that starts to cause blood vessels to leak and cause new blood vessels to form. That's this hormone called vascular endothelial growth factor. And so it's released by tissue that's lacking blood supply, and it's the body's way of knowing where it needs to grow new blood vessels. It's the same stuff that's released in a diabetic eye when there's damage to the retinal blood vessels. And so it's just about where that release of mediators is coming from. And in macular degeneration, it's happening at the level of the wall of the eye. That's why the new blood vessels form under the retina. Whereas in diabetes, the damage is to the inner retinal circulation, which is on the inside of the eye, and that's why the blood vessels grow on the inner surface of the retina, not out near the wall.